A startling prediction. A recent study in the Lancet medical journal finds 256 million people will be overweight or obese by 2050 if current trends and patterns continue.
The study, founded by the Bill and Melinda Gates Foundation, looked at obesity from 1990 to 2021 on a national level.
The study authors warn without major reform, the associated burden of obesity on individuals and the economy will be devastating. We talked to a local doctor for some insight. A recent study finds by 2050, in most states, 1 in 3 adolescents and 2 in 3 adults will be obese. The number's not surprising for Dr. Marco Andrea Giorgi, a bariatric surgeon with Brown Surgical Associates. He says he agrees it's a health crisis that needs a 360-degree approach, not just individual health changes, but societal ones.
Sometimes we focus on fixing a problem without thinking why the problem came to be. From a society standpoint, it's tough because if somebody has to choose between making a little bit more money to make it to the end of the month or cooking, then the choice, it's easy.
The study found the prevalence of obesity has outpaced the increase in overweight over time, especially among adolescents. Texas, Mississippi, and North Dakota had the highest levels of obesity, according to the study. The authors are calling for legislative amendments to promote access to healthy foods, social welfare interventions, and improved regulation of the food, agriculture, and marketing sectors.
The problem is not just about the weight, okay? The problem is about what the weight does to your body over time. If things keep going a certain way, we're going to be in a situation where we will have to manage all these consequences of obesity in medical terms. So the diabetes, the blood pressure, the cholesterol, and those things will be true medical crisis for some of these families and patients because the comorbidities and the consequences are very dire.
The study found those complications have increased in prevalence by more than 140% in the past 30 years and have become one of the leading causes of healthcare spending. And particularly concerning, according to the study, nearly 20% of children ages 2 to 19 years old lived with obesity. They say this has led to an increase in cardiovascular disease risk factors like hypertension and nearly doubled the prevalence of type 2 diabetes in the last 2 decades. We have a link to the full study on WPRI.com.